Hello, folks. Welcome to my channel here where we do some Soma Breath Meditations, many different types of meditations. So I'd like to talk about the different breath rhythms that we use, as well as the breath holds and some contraindications. So we do breath rhythms. We breathe in for 4 and out for 4, for example, and this creates coherence in our system throughout all the body systems. We might also do in for 2 and out for 4, or in for 4 and out for 8. And when we elongate the exhale, making it longer than the inhale, this really leads us into a state of relaxation. It's great for falling asleep. It's great for digestion, right? It's much more relaxing and calming when we elongate our exhale. It also helps us increase our CO2 tolerance when we elongate our exhale, which can lead to healing and regeneration. Sometimes we also use faster breath. We might breathe in for 2 and out for 2, or in for 1 and out for 1. And in these situations, we are raising our energy, we're increasing our access to creativity. This is the time where it's easier for us to receive messages that might lead to new belief systems. It also allows us to release trauma. It can also be used for things like creating heat in the body before a cold plunge and so forth. So different meditations have different purposes. And so you might look through the different meditations that I have posted. Some are for relaxation, some are for energizing, some are for journeying, and they contain different types of breathing. In most meditations, we do breath holds. So a breath hold will come after a round of rhythmic breathing. And what will happen there is you'll breathe in, release all that breath out, empty your lungs, and you will sit there with empty lungs. And this can be difficult for some people. And if you need to take sips of air during that time, you may. You just take a quick sip in, let it out, return to that breath hold. And that pause allows for deep healing, cell regeneration, clearing out any damaged cells. It also allows for insight, new messages perhaps that might come in that you might need for healing. It helps us develop this intermittent hypoxia that's also good for CO2 tolerance, mimics high altitude training, right? So those breath holds are useful. And at the end of a breath hold out, we will then take a deep breath in, squeeze the Mula Bandha, that's the pelvic floor. So we're tightening those muscles all around the pelvic floor. We're bringing the energy up our spine, and we're holding the breath in for 30 seconds or so. And again, this is a time where we're opening our mind up to new thoughts and new ideas. And then we release that breath out. We let some normal breath, just rhythmic breathing, come back in before we enter a new round of breathing, or perhaps we are going then into the final meditation stage. Now, these breath holds are contraindicated for some people. If you're pregnant, you don't want to do any breath holds. And if you have something like epilepsy, COPD 2 or 3, irregular heartbeats or heart eurythmia, a pacemaker, you've been ill, maybe you have uncontrolled blood pressure, things like that, you don't want to do the breath holds. And all you do then is simply just continue to breathe rhythmically or gently while we do the breath holds. And then when the breath count, the rhythmic breathing comes back in, you just rejoin. So if you've had any kind of serious illness, cancer, any kind of surgery, just avoid the breath holds. You might also consider avoiding the breath holds if you have severe tinnitus or a hernia until you talk to your doctor or see about whether breath holds are contraindicated for you or not. Whenever we do these meditations, we want to make sure we are in a nice, private, quiet space where we won't be interrupted. They're wonderful with headphones because the music itself is hypnotic and really gets us into a deep meditation, and it works better if you do have headphones on. You don't want to meditate while you're driving or you're in the water or any kind of place where you could put yourself in danger or anybody else in danger. And additionally, it's best to meditate on an empty stomach, an hour and a half to 2 hours after eating. Although some of those meditations that are more rest and digest, where you have an elongated exhale, are actually great for digestion. So those are some of the basics. A couple other key facts about our breathing. We breathe gently in and out with no pause between the inhale and exhale. We breathe in through the nose and out through the mouth. Breathing in through the nose can increase the nitric oxide. It can stimulate the vagus nerve. So it's much better to breathe in through the nose. When we breathe in through the nose, we're going to be doing diaphragmatic breathing, which means that you will feel your belly rise before you feel your chest rise. So your belly fills and then your chest. And then we release the breath out the mouth. You can at times release the breath out the nose if you prefer. But sometimes when you're elongating that exhale, it's really helpful to let that breath out the mouth, especially if it's like a 4-8 count. And if it's hard for you to draw your breath out for 8 counts, you can purse your lips and release it. And as you get more advanced with the breathing, we contract the Mula Bandha as we breathe. And this helps us create energy, builds up that creative energy force within us, builds up any kind of release if we need it. And the way you do that is with the breath in, you'll contract all the pelvic floor muscles and bring the breath up the spine. So you breathe in, contract, hold, and then as you breathe out, you release the Mula Bandha. So you breathe in, contract, release, and with the out breath. And so you'll notice that in some of the meditations, you're directed to contract the Mula Bandha. And if it's hard for you and you can't do it at first, that's fine. And as you practice more, you'll be able to contract the Mula Bandha more easily. So those are some of the basics, and I invite you to practice. And if you have any comments, please leave them for me. I'm interested in your feedback. Thank you.